Dr. Hammond, tell me a little bit about what cataracts are, because I mean, all of us are kind of curious of what those really are.
And all of us will get it if we live long enough. A cataract is simply the natural aging process of the lens that's inside of your eye. So if you think of a camera, camera has a nice clear lens, gives you good pictures. If that lens gets dirty or has scratches on it, it doesn't take good pictures. Same thing happens in your eye. You have a natural lens that when we're young, it should be crystal clear, and as we get a little older, it turns kind of opaque and a little bit yellow, and the light won't go through it anymore. So let me show you what I mean.
Yeah, dude, I love visuals.
If you look here on this screen, this part right here is the cornea.
Okay.
So we're not talking about the cornea, and sorry, I
Nope.
a little bad there. This is the lens right here, and it should be crystal clear, just like it looks like in this picture. But as we get a little bit wiser, we say here in our office, it starts to get kind of yellow right in here.
Okay.
And the light, as it comes in, just won't focus anymore like it should.
Okay.
It gets hung up on this lens. And so we simply go in and we remove this structure here, the old lens, and we put a plastic lens in its place. And that plastic lens is measured just for the patient so that they can see really well when they're done. Clears it right up.
And how long is that surgery?
The surgery itself takes about 20 minutes.
Okay.
And we make a...
And you do it here?
We actually do that at the hospital.
Okay.
So at either hospital, we make a small little incision, 1.8 millimeter incision.
Tiny.
Very small incision. And we remove the lens with an ultrasonic device, breaks it up into tiny little pieces. You don't feel it.
Sounds kind of complicated.
It's very technical, but it's a very common procedure. Well, in fact, one of the most common procedures done in the United States every year. And then we just fold up that new lens, and we slide it through that little tiny incision, and then unfold it where it should be.
Sounds pretty easy enough.
It's really cool. And let me show you a little example that I have here.
Yes.
This is a mock-up of one of the lenses that we put in the eye. Now, obviously, this is bigger, but this is exactly what it looks like.
What are these things on
These
there?
are little legs that hold it in place inside your eye, and we fold it up so it'll fit through that tiny little incision, then we just unfold it so it fits right in where it's supposed to go. And there are several different types of lenses available now, and the important thing with cataract surgery is that you kind of know that there are options. For years, we just did cataract surgery kind of like appendix.
Okay.
If you have your bad appendix, we take it out.
Yes.
Well, now, instead of just taking out your cataract and putting in just a standard kind of lens, we can put in a lens that lets you see far away and up close, so you can get rid of your glasses.
And that's nice.
It's very nice.
Come this far in technology.
Right. So there are a lot of choices available now.
About what age does someone usually typically get cataracts?
Anywhere after 60 usually. Now, there are some people that will get them much earlier than that, but around 60 is kind of a common age.
Are they usually like a genetic disposition or something?
No, we'll all get them.
We'll
If we all live to be 120, we'd all get cataracts.
So we're all going to need this eventually.
Yes, eventually. So
Thank
cataract surgery it's really life-changing.
Well, thank you so much, Dr. Hammond.
Thank you.